Hi everyone, my name is Laura, and for my tutorial I'm going to be talking about figure 2.17 seizures. Before we start, I just wanted to share a fun fact. The word seizure came from the Greek word for to take hold. To start, I will define the word epilepsy. Epilepsy is a brain disorder which is marked by seizures. So epilepsy is the disease someone may have, and then seizure is a symptom a person with epilepsy would experience regularly. So to start with an understanding of what someone's brain would look like if they're not seizured, the firing of their action potentials would be more or less desynchronized. The regions in the brain all function independently. Now, when someone's experiencing a seizure, this means that all the electrical activity in their brain is being synchronized. There are many different types of seizures. To start, we have generalized seizures, which encompass the entire brain. The first example of a generalized seizure is the tonic-clonic seizure. This seizure contains abnormal EEG activity all over the brain, as you can see in the picture on the right. The symptoms of this kind of seizure are loss of consciousness and rhythmic convulsions. This is the kind of seizure you think of when you think of a very serious seizure, when someone completely loses control of their body. The next seizure is the simple partial seizure, which is also referred to as an absence attack. So, like the tonic-clonic seizure, this seizure also encompasses the entire brain, but the level of activity is less intense, and it also comes across differently because there's no unusual muscle activity. Instead, people who suffer from simple partial seizures will be unaware of the environment, and they'll be unable to recall the events that happened during the seizure. So this is often called a staring seizure. The person just stops what they're doing and stares. So this is a lot less severe than the tonic-clonic seizures, but it is still severe. As you can see, the EEG activity on the right is similar to the tonic-clonic seizure. And the last type of seizure I'll be talking about today is the complex partial seizure. The complex partial seizure is a focal seizure, meaning that it does not involve the entire brain, unlike the last two that I talked about. Instead, it focuses in on a specific region in the brain, and an interesting thing about this kind of seizure is that the symptoms people experience correlate to the brain region that it is affecting. And so if there's unusual neural activity in a part of the brain that affects hand movement or something, that's what would be affected. And so this means that there's a wide variety of symptoms people experience. Something interesting also is that people sometimes experience an aura, which is a premonition preceding the seizure, something like a tingling or a sense of foreboding that the seizure is about to come up. People have unusual muscle activity or just unaware of what's going on in the environment, just like the last two seizures, as well as a variety of other things. And so the severity is generally less than the other two, but it will range substantially. The causes of epilepsy are not very straightforward. There's a lot of things that could cause this disease. So injury is one, especially injury to the brain. Trauma in the form of head trauma, as well as there's been some studies that show that extreme stress and PTSD can correlate slightly to epilepsy. And then lastly, metabolic problems can predispose the brain tissue to produce synchronized activity. So as for diagnosing seizures, EEGs are extremely important. EEGs are recordings of electrical activity, and they can be used to detect epilepsy when an organic cause is not detected. The pictures I showed earlier in the different types of seizures were pictures of EEGs, and so is the next slide. And here is a figure just to show the difference between, on the top, the normal active brain EEG versus on the bottom, what an EEG looks like during a seizure, and you can tell that the neural activity is just going wild on the bottom one. And lastly, we have treatment. So unfortunately, there is no perfect treatment for seizures. Anti-epileptic drugs can help reduce the effects of seizures and control them because they reduce the excitability of neurons, and so they control the electrical activity in the brain. But often seizures are too severe to be controlled with these drugs, and so in the case of life-threatening seizures, sometimes surgery is required. So doctors will remove parts of the brain that are causing the seizures in order to attempt to solve the problem completely. So this is all I have for now. I hope you all enjoyed this slideshow, and have a great rest of your day.